We can see you, Dr. Gupta.
Yeah. Okay. Hello, everyone. I'm Dr. Naeem Mujawar, DLife member, India's first and the only award-winning low-carb platform. DLife was founded in 2014 by Anup Singh, a silver medalist from IIT Roorkee and the recipient of Icons of India Award. Anup is the pioneer of low-carb movement in India with his path-breaking protocol of 100 grams carb per day max given by him in 2012. That made not only LCHF but even type 2 diabetes reversal possible for Indian vegetarians. In 2021, DLife launched its diploma course, which is the only course approved under NSDC partner, the Government of India, in the segment and the only course with global biggest 144 hours CPD hours credit. Anup Singh along with Shashikant Iyengar is the co-organizer of the Metabolic Health Conference. My co-host today is Sayan Datta, who is a certified metabolic health coach. So I would like to introduce to my dear friend and colleague, Dr. Gopal Aironi. Dr. Gopal Aironi is a health practitioner specializing in classical homeopathy, meditation coaching, and metabolic health. As a homeopathic doctor, he tailors treatment to individual symptoms, emphasizing the body's innate healing ability. Certified as metabolic coach through DLife, he helps his clients reverse metabolic diseases through low-carb nutrition and lifestyle changes. As a meditation coach, he guides individuals towards mental clarity, emotional balance, and spiritual growth. Dr. Gopal's holistic approach integrates ancient wisdom with modern science, addressing physical, mental, metabolic health for sustainable well-being. So, yes, Dr. Gopal, are you ready?
Yeah, thank you so much for this introduction.
It's my pleasure.
Yeah.
So, I would like to ask you, how has the transition been being from homeopath to LCHF metabolic health coaching?
If I go back to 2014, when I was almost getting frustrated with, I have been a very good homeopathic practitioner, almost a fanatic one. So I never looked beyond homeopathy anytime. But though I was very successful in the practice, but there were so many stumbling blocks, especially the lifestyle diseases people came across, like diabetes, hypertension, coronary artery disease, Alzheimer's, Parkinson's, PCODs. I didn't have a way forward. So I was wondering, what am I here? Like, am I here to only do treat colds and coughs and fevers? That's not my lot. So I've been keep pursuing a lot of other modalities from 2014. And then eventually I stumbled upon few handles on Twitter. One handle was Anup's and another Shashi Iyengar's. And then I started following them. As I was following them, I was getting a nuanced understanding of this low carb 100 gram carb protocol template that Anup proposes, and I started experimenting on myself. I also suffered from gluten intolerance, and I started avoiding gluten and taking other millet rotis and all. But I found that not helping me reduce my weight. At one point before COVID, I think I touched almost 87 kg weight. I was in full-blown insulin resistance. I understood what insulin resistance is by then. And yeah, I had renal stones. I was having joints pains, and I had undergone cataract surgery, bilateral cataract surgery in COVID. So I was wondering what's happening with my health. I have never neglected my health, and I consider whatever I'm eating to be a very normal diet that anybody. I don't do much of hoteling, not much of partying, teetotaler, and yet I am suffering from all these things. And I realized I was in a metabolic disease condition with full-blown insulin resistance. And then I said, I need to step back and take a look at what I'm doing actually. So that involved a lot of learning and unlearning, mostly unlearning. And then from COVID time, I started experimenting on my patients. I have done my experimentation on myself, and then started prescribing the diet for my patients. One particular interesting case that comes to my mind is the first patient who I was struggling with treating his gout, the uric acid levels. He was having almost uric acid levels about 12.5 and all. I was able to manage his pains and swellings with my homeopathic medicines, but I was not able to substantially reduce the uric acid levels. So I proposed him that let us for 1 month, just 1 month, do this. And I shifted him on a completely carnivore diet. Mind you, a patient with high uric acid levels, for which I always said no proteins, no non-veg, no dals, no sprouts. And here I am telling him to shift on carnivore diet. That was a big shift in me because earlier, whenever a uric acid, elevated uric acid levels had come across me, I was to be very stern and strict regarding the diet of the patient, where I totally asked him to avoid proteins. And here I'm totally putting him on carnivore diet. And you won't believe, within 15 days, the uric acid levels started dropping down, like from 12.5, it came down to 10. And then next another 15 days, it came to 9. And within 3 months, he reached a normal uric acid level of below 5.5, 5.4, like. And and I was not looking at the weight loss that was happening along with, because I was more focused on the uric acid levels. And here he lost almost 15 kg weight in those 3 months.
Okay.
And everybody was surprised. And another 3 months, 6 months, he had lost 27 kgs of weight. And he was working in a bank. And people were surprised because they had seen him before COVID. And during the lockdown, they didn't see him. And after the lockdown, he comes to the office and in a totally different shape. And people were so astonished. And uh, then they requested me to come to the bank and deliver a lecture on what this new nutrition fad, they called it then, nutrition fad, that is. And I said, okay. So there was almost a crowd of 120 bank officers, all the staff, and I delivered my first lecture on low carb. And I'm telling you, I had not joined the course then still. I was just getting all the information from the tweets that I was reading. I was following Ira, Shashi, Anup, and all the DLife members. And by then, I was quite accomplished in the way that this diet works, the way this nutrition protocol works. I had got a very fairly good understanding of what insulin resistance is by then. And after that session, I enrolled for the course. So I enrolled for the course because from that session, I almost got 20, 25 clients in the next month. Like,
Oh.
and that was a complete change in my practice. Like as a homeopath, I used to interview my client for a 1 hour consultation or 1.5 hour consultation to get to the right remedy. And here my consultation length started going up to 2.5 hours to 3 hours, because
Okay.
again, I have to explain about the diet, the insulin resistance part, the metabolic disease part and all. Yeah, that's how the shift happened. Yeah.
Yeah. We already know this. You had already told. Yeah, that's great. And this must be very rewarding when you did this, right?
Oh, of
Yeah,
course, of course.
yeah. So another thing what I would like to ask is, what is the most common metabolic disorders you see in your practice, and how much of a role diet plays in the same?
Over a period of time, like, okay, in the beginning, 2020, 21, when I was started practicing this in my this thing, there was a stark, clear-cut boundary of metabolic disorders in my mind. Like, so most of the patients that used to come were for autoimmune diseases, for asthmas, for coughs and colds, for skin conditions, psoriasis, eczemas, arthritis, and all. And once the patient comes to me, it sticks to me for a lifelong, almost, like. So there are families who have been with me for last 20, 22 years, like. And then I find them going into metabolic diseases like diabetes, hypertension, coronary artery disease, and I can't help them. So mostly the patient that come across to me is diabetes, hypertension, coronary artery disease, PCODs in females. And then that boundary started getting blurred now. Now I see, every time I see a patient, I see there is some element of metabolic disorder in him. even if he is an asthmatic, even if he is a patient with arthritis, even if he is a patient with eczema or psoriasis, I do find some kind of insulin resistance or metabolic syndrome or nutrition gone wrong. So now it's almost the boundaries have coalesced, and so every patient that comes to me, whether he comes for a recurrent cough and cold, also is guided towards a proper metabolic health way of nutrition and health. Yeah.
So that is a holistic approach, I see.
Yeah.
You are taking. That's very nice. Yes, Sayan, would you like to proceed with the next question?
Sure. So thank you, doctor, for joining us and giving us, this transition that you had. One of the questions I have is that when you talk to your patients and when you talk to other fellow doctors, and the reason I'm saying is that being a certified coach, we face a lot of challenges inside the family also at times to get them convinced about this revolutionary way, because it's not common still in India, right?
Yeah.
And I'm sure you kind of understand that from your patients also. But what are the kind of discussions you have? How do you encounter that? There's misconceptions about, like you said,
Yeah, of course. There is a sea change in understanding of
moving
what.
them into a carnivore diet in a yes,
Yeah. Am I audible?
protocol kind of a thing. How do you counter those kind of yes, you are. We can hear you.
Yeah, of course. The first difficulty is within the family, because there is a sea change in the understanding of diet and nutrition, and what a typical Indian diet of dal, roti, you need to abandon that, and the family is not ready for that transition. So it takes time for you to convince your family and then convince your near and dear ones. And of course, the same case is with the patients. So most of the times when a male patient comes to me and I explain him, I'm doing the myth busting for him. He has understood the science behind the nutrition. He has understood why he's getting this disease, why his health has suffered. When he gets a good insight into this, then the biggest question that comes to his mind is, how do I convince my family? So most of the time, I have to do a second consultation with the spouse, then with the wife of that patient. And I get on a Zoom call and I say, this is what it is. You have to just follow it for 1 month. And if you are able to follow it for 1 month without any cheat, I will assure you, I will guarantee you that you will be convinced about this diet. And if you are able to follow up this diet for another 3 months, like 90 days, people will start following you. It's not about you being convinced. People will start following you. What have you been doing? Please tell us. Just yesterday, I received a call from a female. She is kind of a eklavya. She has never come under my consultation. But I happened to visit her village and I said, this is what I eat. I don't eat the pohe and upma and kind of things. So she understood the diet in a brief this thing. And without telling to me, without me knowing, she was following that diet for almost 6 months. And then her brother-in-law comes and, your disciple has lost 10 kgs weight. I said, who's which disciple? She said she has already lost. Her son has lost another 15 kgs weight, and they are following your diet, but they have not been on my consultation. And yesterday she calls me and said, my neighboring families want to understand this diet. Shall I tell them? So that kind of it's a ripple effect that this diet has. And if you so many times I've discussed this with Dr. Naeem also. When a patient comes into my consultation and understands the diet is not for only him, it is for the entire family. Sometimes it is so generic that the entire family can adapt to that diet. Of course, individual clients need more nuanced approach to the diet. There are some protocols that an individual person needs to follow according to his condition that he is in. But there is a generic way of, and the whole family starts adopting that diet. And the best part is, children get accustomed to that diet so early, it becomes a part of their cultural milieu of that family. and it seamlessly gets integrated in their as a family culture. I've seen this happening so many times.
Sure, that's great. And both of you are doctors here, so I think, and one of the things that we pride ourselves in DLife is it's made for India, right?
Yeah.
And that's a pretty key, unique USP we have in DLife today, which Anup and Shashi and Ira has brought in.
Right.
Um, how have you encountered this entire process of making this low carb concept implementable amongst your patients in a very Indian context, particularly in urban areas? Still, people kind of understand it a little bit more because of exposure to various literature or various social media things. But when you move a little bit away from big cities, and I'm sure you have a lot of patients coming to you from those areas also, and we have some viewers today probably are listening to us. How do you kind of make that transition happen? Dr. Gopal, if you could just take 2 minutes to answer, and then Dr. Naim also, you could shed some light on the same.
My USP with my clients is when I take the history, we have a very detailed history taking in a homeopathic way. So by the end of the history, we have formed a chronology of the events of the medical health crisis that the patient underwent right from his birth till date. So we get a good chronology. And based on that chronology, it is very easy for me with this understanding of metabolic syndrome and all to pinpoint exactly where the metabolic disease started, at what point in life started. So my USP is I explain to the patient in his own language, in a very simple terms, how this has happened, how the diet, the eating habits that the patient has been having for all these years has led to the formation of this condition. And once the patient understands this, once the patient gets a knowledge of how he has become sick and what things are that have happened in a sequence, and he is almost able to predict, or I help him predict what next is in store for him, what medical condition is next in store for him. And once he understands that, of course, there is a little bit of fear that the patient gets into, anxiety the patient gets into, but I assure him that this is very much reversible and we can work on this very easily. And with the assurance, with the nudging that we do, I eventually bring him to an understanding where, okay, we have to shift this completely over carbohydrate dependent diet to a protein diet or a high protein, high fat diet. And slowly the diet, I take a daily routine diet chart that the patient has been following all these days. And then from that, I just remove the carbohydrate part and supplement it with the protein. The biggest challenge that comes to me is patients following a vegetarian lifestyle. And I get a lot of patients who don't even eat. I being a meditation coach, so my around the ecosystem, many people are ones who don't even consume eggs. So they are totally vegetarians. And fortunately for me, at least they don't have a problem with the dairy products. And if a patient has some problem with dairy products and he is a vegetarian, I just say, I can't help you, because there is no choice that I can offer that particular person. So, but when a vegetarian comes who has no issues with dairy, then yeah, I remove the carbohydrate part and supplement with the protein. So, when I'm telling this, I say, see, when we have decided to adopt a vegetarian diet and abandon shunned non-vegetarian diet, you have to find compensation for the nutrients that are lacking now. Without doing the compensation for the nutrients like proteins and fat and other micronutrients, how can your vegetarian diet keep you healthy? Just eating dal, roti, sabzi is not going to help you, because you will be lacking so many nutrients and micronutrients. And patient get convinced, and I tell them to encourage them to practice for 1 month. And if they see the result, then they can come back and have a more detailed protocol from within. So many patients do agree because they have worked with me for many years and they do listen to me. But of course, there are some patients who say, no, this we cannot follow. And of course, as you said, many patients that I have come from the rural and semi-urban background, money is a big issue, and they think that this diet is very expensive. But we find ways around that and say how the cost can be mitigated easily. Yeah,
So,
but
thank you so much.
largely patients accept
Yeah.
this.
Thanks so much. Dr. Naim, if you have any one last question you would like to ask Dr. Gopal.
Yeah. So I've been, yes, Dr. Gopal,
Yes.
what last message would you like to give to everyone?
Indians need to take care of their health. They're heavily carbohydrate dependent. And with the cultural propaganda that is happening all around of veganism and vegetarianism, I say, okay, I respect your beliefs. Even I am a vegetarian person, but you have to compensate for the lack of nutrients that one would have got in a non-vegetarian diet if you are following the vegetarian diet. So being over dependent on carbohydrates will make you deficient in important vital nutrients for the body. So and as we all know, India is capital for diabetes. India is capital for hypertension, coronary artery disease. It's a capital for entire metabolic health syndrome now, with large percentage of population going under its weight, and the health cost is so enormous once one gets a metabolic health disease. So it's very urgent, very important, pertinent for them to pay attention to the diet and at least reduce carbohydrates to 50%. Like what Shashi Iyengar usually tells, if you cannot follow a low carb diet or 100-gram carbohydrate template, at least reduce carbohydrates to 50%. And I tell my patients that, and I recommend that to everybody in India.
Yeah. That's great.
That's great. So thank you so much, Dr. Gopal. Thanks, Dr. Naim,
Yeah,
for
thank you so
co-hosting
much.
with me. Yeah,
Thank you so much.
Shashi, do you want to add anything before we close? Shashi, Anup.
So get in Anup also.
Yeah,
Can
Anup is
take
also
me.
here.
Shashi, I think, is not here. You can take me in.
I'm here.
Oh, then come in.
Nice to see you, Anup.
Yeah, thank you.
Nice to see you.
Yeah,
Thank you,
Dr.
thank you.
Dr. Gopal, thank you very much for coming and sharing. Of course, we heard your great inspirational story in length when you spoke in the homeopathy college when we had a session on metabolic health, and very inspiring. And thanks again for sharing with everyone, because a metabolic health recovery coming with 100 grams carb template from Anup, and especially from a doctor, is going to be very inspirational for all. So thank you very much.
Yeah, thank you, Dr. Gopal. Take-home message is this diet is for family, as you rightly pointed out. And today morning, I was discussing with Dr. Sridhar. He said if this message spreads far and wide, the stress on healthcare system will be less, and it will be left to deal with only complicated cases.
Yeah.
So
my first target is to reach out to all my homeopathy colleagues, students in homeopathy college. There are 56 homeopathy colleges in Maharashtra. And it's my very inner longing that I reach out to these homeopathy colleagues and share my experience with DLife and this 100-gram carb template with everybody. Yeah, thank you so much for having me
so
on
much,
this.
everyone. Thank you.
Thank you, Dr. Naim. Thank you, sir.
Thank you, sir.
Thank you.